millions of girls and young women across the subcontinent, the world came to a stop last year. And we noted skyrocketing notifications on violence, school disruptions, sexual reproductive health and rights services disruptions, as well as a high increase in early pregnancies. And I know that this may seem really disheartening, but the resilience of girls and young women and their supporters has been so inspiring to watch. And we know that for many of you on the ground, you've done incredible work to ensure that there's adequate safety nets. Now, for the next session, we are going to welcome 4 leading practitioners who are going to give us an overview of where we come from, where we've been, and where we are now, and where we want to go in the future. And I'm going to welcome them, and this is going to be a fishbowl discussion. And how this is going to work is that I'm going to allow them a moment to briefly talk about how we scale up programs that take the girl or young woman's whole needs into account. Once they've given us their brief discussions around this, then we're going to open up the room to all of you to share with us, especially as in-country executives and leading implementers, on what your experience on this has been. So I would really love to welcome at this point Isolde, Larissa, Lynette, and Arwyn to this conversation. I'm going to ask all 4 of them at this point to please switch on their cameras, as well as speak slowly for our translators. I'm going to introduce them shortly. I'm going to read this so I don't get it wrong. Isolde Birdthistle is an associate professor at the London School of Hygiene and Tropical Medicine, where she has served as a lead investigator for inquiries into what can be learned from major investments. She's worked notably for the Dreams partnership that I'm sure we are all aware of. Then we've got Arwyn Finnie, who is a senior data evidence and policy officer at Girls Not Brides, the global partnership to end child marriage. We also welcome Lynette Mudekunye, who is the Deputy Director for the Regional Psychosocial Support Initiative, which has conducted inquiry into the lives of young women and girls and the risk of a range of suboptimal health and well-being outcomes. Last but certainly not least, we've got Larissa, who's a project manager at the International Treatment Preparedness Coalition, where she leads a novel citizen science approach that avails real-time insights into the lives of young women. I'd like to please welcome at this point Isolde, who will start, then hand over to Arwyn, then Lynette, and then Larissa. Over to you, Isolde.
Thank you, Sibu. And thank you so much for this platform inside this fishbowl. It's lovely in here. So I was asked to speak about practical design and delivery of multi-sectoral programming. In 1 minute, Dreams is a great opportunity for us to learn about that. It's doing what many of us have called for a long time, offering packages of integrated, differentiated, evidence-based interventions to address the underlying determinants of girls in a holistic way and scaled up to district level, everything we dreamed of. And that's easy for us all to recommend and not so easy to deliver. And I think that's the point of why I've been asked to share what we've learned. And I'll get specific quite quickly. We saw a huge wide range of models for delivering multi-sectoral programming in Dreams. One way that really stands out a lot is through mentors. And I want to share some insights from recent analyses of our qualitative data in Kenya, particularly work led by 2 really impressive young scientists, Madeline Ireland and Rosa Nasavila, and I hope they join me in this fishbowl to answer any questions you might have. So through their analyses of in-depth qualitative data, they've exposed a lot of insights that we're gaining, that mentors, they were young women from the same communities as the Dream clients. They were selected to organize and deliver multiple interventions through safe spaces. They had a huge number of roles and Dreams. And I hope I can just very, very quickly show this as I speak, just to illustrate how Madeline has illustrated the ways in which they themselves saw themselves, from public figures to role models, counselors, sisters, parents, volunteers, even celebrities. In practice, we saw the role they played helped with integration. They were like the glue linking girls from one intervention into another, sequencing through those interventions through referrals, or personally escorting them physically, helping them to use service passports. We saw that they were able to help demedicalize a lot of interventions, treating girls and appreciating the wider context in which they lived through counselling and support in non-judgmental ways. They helped to decentralize, offering things in community-based settings in those safe spaces, not relying on adolescent girls to attend clinics before they got any services. So we can see that that does address a lot of the community ownership and the youth leadership that's needed for programs to really embed and work very well. It's a win-win opportunity for empowerment of young women, both the clients of Dreams and the mentors themselves, especially if that opportunity is taken to strengthen them economically, considering mentorship as a livelihood and preparing and linking them then into careers in counselling or social work or community activism and maybe science and research. But I want to just end by focusing on a note of caution not to exploit this resource. There were huge demands on their time and often not enough support and compensation for that. The delivery model depended on them. They were instrumental to it, but they didn't often feel considered as implementers themselves or employees. They saw themselves as volunteers. And they often faced stigma or criticism for the program as the face and the front line of Dreams. So not long ago, peer education was a very popular programming choice. It tapped into a huge human resource pool with large reach at very low cost, presumed to be very cost effective, but in fact it came at a cost. It was insufficient training, sometimes insufficient support, meant passing on inaccurate information and not achieving program goals. And relying on volunteers led to high turnover and attrition, and that deteriorated the quality of many programs. So let's not forget the lessons from peer education. Whether we want to really promote mentorship formally or related models of peer navigators, peer counselors, adolescent supporters, let's think of it maybe as a business model, not relying on volunteers or goodwill, but investing really in the careers of young women and then winning by achieving multi-sectoral programming through that model. Thank you.
Over to you, Arwyn.
Thank you, Sibu, and thank you for inviting Girls Not Brides to be here today as part of this discussion. So Girls Not Brides has always advocated for a comprehensive approach to addressing child marriage, which is quite similar to the approach that was outlined by one of the previous speakers. So we've always recognized the importance of addressing girls' needs holistically. So in terms of things like education, access to appropriate sexual and reproductive health, as well as laws and policies and community engagement. And two of our key learnings over the last 6 months are, first of all, our increased awareness of the importance of including economic interventions in a comprehensive approach to addressing child marriage. And this is something that maybe didn't get as much attention as it should have done in the past. But several new key pieces of evidence over the last 6 months have made us refocus some of our attention on this. So the first one is there was some new data from UNICEF that was published very recently, which showed how unequal progress on reducing child marriage has been between girls from the richest and the poorest backgrounds within individual countries and within regions. And you can see in several of the regions of the world where child marriage has actually declined quite significantly, even within these regions and countries, actually child marriage has increased for the girls who come from the poorest backgrounds. So the progress that we are observing has not been equal at all. Then obviously, all of this is taking place very much within the context of the COVID-19 pandemic, which we know has led to school closures, disruption to healthcare, and more families being pushed into poverty, all of which is already leading to and will continue to lead to increased rates of child marriage and adolescent pregnancy. And economic interventions and livelihoods, support for increasing access to livelihoods, is now being mentioned by our members in different forums, particularly in the African region, as an area where they want to see further investment and further research to better understand how these types of interventions can really support girls to have alternative career paths and alternative life choices, and to support them to avoid early marriage. So in terms of what this means for us, at Girls Not Brides, we have a renewed commitment to include the most marginalized girls in our programming and advocacy to end child marriage. And at a practical level, this means promoting an inclusive and intersectional approach and making sure that the organizations who are part of our membership, who are doing the work directly with marginalized girls, are supported and adequately funded, because it's very clear that we will not end child marriage, we will not achieve any of these broader health gains, we will not achieve gender equality if we do not make an effort to consciously include the hardest to reach and most marginalized girls. And the last thing I wanted to quickly mention was that, as another area of learning for us, has been that I think in the last year there has been something of a perceived tension between the need for structural interventions delivered at scale to increase things like girls' access to education and healthcare, and engagement with communities on social norms. And from our perspective, we feel that both of these things are equally necessary because they are complementary. So if you look at things like girls building their agency to make their own choices about their sexuality, to make informed choices, to practice safe sex, it's really fundamental that we engage with communities, and that includes parents, boyfriends, men and boys, around girls' rights, girls and boys' sexual and reproductive rights, as well as providing those services will actually enable them to exercise those rights, because there's not much use in girls having great agency and feeling empowered if they don't actually have the practical tools in terms of things like condoms, which will help them avoid sexually transmitted infections, and effective methods of contraception. So that is it from us. Thank you very much.
Next up, we have Lynette. Lynette, you're up next.
Thank you so much. I am Lynette Mudekunye from REPSSI, which is the Regional Psychosocial Support Initiative. We work in almost exactly the same 13 countries as the Global Fund's priority countries. The only difference is we are not in Cameroon and we are in Angola. Over the last year, we did some baseline work, baseline assessment of kids that we are working with in different programs in most of those countries. And a couple of things really surprised us, and we have different programs that we are doing with them. One of the things that hit us really hard was just how high the levels of orphaning still are. And many of these were simply kids who had joined a club in their school. So we were not trying to reach the most vulnerable children, even though we are working in communities that we recognize are very vulnerable. In two countries, Zimbabwe and Malawi, we are specifically working with groups of young adolescent mothers. And the rates of orphaning in those particular groups were much higher than in other children, as much as they were high in the other groups as well. So for us, that was one thing that said, how much attention are we paying to the caregiver relationship between whoever is the caregiver of this orphaned child and the child? Because there is some relationship there. What it is, we're not sure of at the moment, but we think we need to go back to some of the basics. And when Arwyn talks about needing to look at families, parents, caregivers, we definitely agree with that. Another thing is in the countries where we asked about age of sexual debut and how many children had actually already initiated sex, we found it was very young amongst those who had initiated. It was not all of them. And these were groups of children 12 to 18 years old. And the percentage who had initiated sex was 3 to 4 times higher than the percentage who told us they were accessing condoms. So again, back to real basics. We're not making SRHR services available to children. How are we communicating with them around when to initiate sex? And it was young for some of them, 10, 11 years old. And the average tended to be around 14, 15 as the average age of initiation. With the adolescent mothers, they had the proxy indicators for poverty, having a tap with running water, access to electricity, being hungry at least a day the week before, were all much higher for them. So I agree with you again that the issues of livelihoods are absolutely fundamental. For us at REPSSI, we are really concerned with how many children were out of school for extended periods of time, and not just out of school, but not learning. Being out of school when you have access to the internet, to books, to television, radio, etc. Governments tried, they made those things available, but so many millions of children didn't have that. And therefore they were out of school and not learning, and subject to gender-based violence is so high, is such an issue for them. So those are areas we are concerned about and that we would like us to think about. Thank you.
Thank you so much, Lynette. Larissa, over to you.
Okay, I took the 1 minute thing really literally, so I'm going to keep it very short and sweet. And I've got another session coming up a little bit later, so I don't want to talk too much about the project that I've run because I don't want to give anyone spoilers for that. But basically, the project that I've been working on has been engaging directly with HIV positive recipients of care over the course of the pandemic to try and understand what's going on in our healthcare system. And what we realized was that it was super important for us to understand a 360 view of people's lives, not just ask them about healthcare, but understand what's going on in terms of food security, you know, whether people have become unhomed, their levels of, you know, unemployment, a range of different things. And the number one thing that we learned when we, like, obviously COVID made it difficult to do research in the traditional way. So we were finding ways to put devices into people's hands so that they could tell us what was going on in their lives and what they needed. And so what I'd like to really say simply is that girls are experts in their own lives. And what we need to do as kind of researchers and as activists is find ways to create platforms for them to tell us what they need and for us to listen to their needs, and then for us to find ways to help them to access the agency that they need to make the changes in their own communities. Because if we're superimposing our solutions onto their perceived problems, we're doomed to failure. So I'm going to leave it at that, and we can talk a little bit more about this as the fishbowl unfolds. Thank you.
Great. Thank you so much, Larissa, Lynette, Arwyn, and Isolde for, I mean, I can sense the passion from across these very stale laptops. You are all so passionate about the work that you are doing, and really, Lynette, felt every single bit of frustration that you have, and we we're really grateful that you could share that with us. And we really now want to also hear from all of you participants. I mean, all 130 of you, we'd really love to hear more from you, you know, and really understand from your experience, what have you seen on the ground, especially? I mean, Janet has already told us here that a high proportion of first sex is not by choice, especially among the girls. And she also agrees with Lynette that there should be a huge focus on GBV. I'd love to, if I may, just ask Jennifer to unmute herself, put on a camera, and give us her perspective, as she's written so beautifully in the chat box. Jennifer Reddock, can I give it over to you?
Thank you. Yes, I did comment on Janet's observation. That's often when we think of or hear of women or young girls who have had early sexual debut, we don't normally think of the context in which they've had this. And there's usually a very complex story that underlies this. And it's usually, as Janet said, not by choice. And there are always so many various dynamics that come into play when young girls have sex at so early. And I think it's really something that we should even make an effort to comment on whenever we mention the early sexual debut, even if we know it's not by their own initiation, to just say that there's a question mark, or that there's certain conditions or constraints that we should keep in mind when we see these numbers coming in so early.
Thank you so much for that, Jennifer. There is another comment from Njeri, I think it is. These groups that are very naive, lack social skills, pursue life thrills, etc., bringing them together within their locations to discuss amongst themselves the many different challenges they've encountered in their day-to-day living, and really just getting us to a point where we focus on you know, taking into account the well-being of holistically of girls and young women. Thank you so much for that comment, and Jerry, to you as well. If there are any more comments, please share with us your experiences on the group chat. We would love to, on the chat box, we would love to hear more from you, because you're the ones who are on the ground. And you know, this is a community where we are learning from one another. I'm going to take this very last one from Ta Admika from PEPFAR, and they say there should also be an acknowledgement of the stigma, harmful norms around the sexuality of AGYW in general, which prevents them from accessing critical SRHR services. So true. Thank you so much for that.